Hi, I'm Liz Mort, the Senior Vice President for Quality and Safety, and I'm here with Dr. David Hooper, who is the Chief of Infection Control, and we're here to talk about the flu. David, how is this year's flu season going?
Liz, it's really a heavy flu season this year. We're tracking at probably one of the heaviest that we've had in any number of years. This dark line here, going straight up, is where we stand now. So we haven't even reached the halfway point of the peak. So it's still very, very active.
Wow, it is a bad year for the flu. So what is the MGH's policy for vaccination against the flu?
Well, the MGH's policy for vaccination really centers around the concept that influenza virus can be spread, unlike many other viruses, before you actually have symptoms, and that puts our patients at risk. So to minimize that risk, our first choice, far and away, is influenza vaccination. For those persons who can't be vaccinated for medical reasons or otherwise, then we have them agree to wear a mask when they get close enough to patients where they might be shedding influenza virus during patient care.
So David, for those individuals who may have opted to decline the vaccination and then pledge to use the mask, some people may have done that earlier in the season before they understood the importance of the vaccination for this particular year, really for all years. But for those people who declined, is there time for them to come back and get vaccinated to get the very best protection possible?
Absolutely. The CDC continues to recommend that people be vaccinated throughout the flu season. And as healthcare workers, where we're dealing every day with very vulnerable patients, it's especially important for us. So for getting flu vaccine now, you can either go to occupational health, they'll provide it for you, it's free, or you can go to other CVS or Walgreens, other places that will provide vaccine as well. So it's reasonably simple still to get, and something that as healthcare workers we should take as a personal responsibility.
Thank you, David. So basically it's a bad flu season and it's not abating. The flu cases are coming in on a daily basis. You saw the chart. Please join all the MGHers, the majority of MGHers who's opted to get vaccinated with their yellow sticker. For those of you who declined, it's not too late. And for those of you who haven't made a decision, please get a flu shot. Bring the documentation from outside if you get it from a CVS or other pharmacy. But call OCHealth. You can get it here at MGH too. So do what you can to keep yourself, your family, and our patients safe.
Absolutely. Protects you, your family, your colleagues, and it's free. What's not to like?
Thank you.